Before I start my speech, I'd like to pull up my PowerPoint for everybody. My name is Haven Riley, and today I'd like to talk about why mental health should be more important. As for someone who has struggled with mental health issues, I'd like to bring some information on why people should think that mental health should be more important. Mental health can cause so many problems and affect so many things throughout people's lives. I, for one, am a big victim of this, whether it has been with my family or just myself in general. Mental health is a person's condition regarding their psychological and emotional well being. 4 types of mental health are mood disorders, anxiety disorders, personality disorders, and psychotic disorders. I do want to talk about what exactly is mental health, why it's important for overall health, is it able to change over time, how common mental illnesses are, and what causes mental health. Also, why mental health should be taken more seriously in the workplace and school. To review my main points again, they are going to be mood disorders, anxiety disorders, personality disorders, psychotic disorders, what mental health is, why mental health is important for overall health, can mental health change over time, what common mental illnesses are, what causes mental health, and why mental health should be taken more serious in the workplace and school. We are starting off with mood disorders. Depression is a common mental health condition. Depressive symptoms include feeling sad or hopeless. The condition can also cause difficulty thinking, memory, eating, and sleeping. For a person to receive a diagnosis of clinical depression, the symptoms must last for at least 2 weeks. Bipolar disorder is a lifelong mood disorder and mental health condition that causes intense shifts in mood, energy levels, thinking patterns, and behavior. There are a few types of bipolar disorder which involve experiencing significant fluctuations in mood, referred to as hypomanic/manic, and depressive episodes. Premenstrual dysphoric disorder is a type of mood disorder that occurs 7 to 10 days before menstruation and goes away within a few days of the start of menstrual period. It is a more serious form of PMS. Researchers believe this condition is brought by hormonal changes. Symptoms may include anger, irritability, anxiety, depression, and insomnia. Disruptive mood dysregulation disorder affects children and adolescents. It involves frequent anger outbursts and irritability out of proportion to situations. Disruptive mood dysregulation disorder is more severe than intermittent explosive disorder, and anger is present most of the time, occurring before the age of 10 years old. Anxiety disorder. Now, these are just some of the symptoms that can be caused with anxiety. Feeling nervous, restless, or tense, having a sense of impending danger, panic, or doom, having an increased heart rate, breathing rapidly, which is hyperventilation, sweating, trembling, feeling weak or tired, trouble concentrating or thinking about anything other than the present worry, having trouble sleeping, experiencing stomach problems, having difficulty controlling worry, and having the urge to avoid things that trigger anxiety, like big social events or just doing anything out of your comfort zone. Personality disorders. Personality disorders are a group of mental disorders. They involve long-term patterns of thoughts and behaviors that are different from what is considered normal in your culture. The thoughts and behaviors are unhealthy and inflexible. They cause serious problems with relationships, work, and social activities. They can make it hard to deal with everyday stresses and problems. There are 10 different types of personality disorders that are grouped into three categories called clusters. In each cluster, they have similar symptoms and characteristics. Psychotic disorders. Psychotic disorders are severe mental disorders that cause abnormal thinking and perceptions. People with psychosis lose touch with reality. Two of the main symptoms are delusions and hallucinations. Delusions are false beliefs, such as thinking that someone is plotting against you or that the TV is sending you secret messages. Illusions are false perceptions, such as hearing, seeing, or feeling something that is not there. What is mental health? Mental health includes our emotional, psychological, and social well being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make healthy choices. Mental health is important at every stage of life, childhood and adolescence, throughout adulthood. Why mental health is important for overall health. Mental and physical health are equally important components of overall health. For example, depression increases the risk of many types of physical health problems, particularly long-lasting conditions like diabetes, heart disease, and stroke. The presence of chronic conditions can increase the risk for mental health. Can mental health change over time? Yes, it is important to remember that a person's mental health can change over time depending on many factors. When the demands placed on a person exceed their resources and coping abilities, their mental health could be impacted. For example, if someone is working long hours, caring for a relative, or experiencing economic hardships, they may experience poor mental health. How common are mental illnesses? Mental illnesses are among the most health conditions in the United States. More than one in 5 U.S. adults live with a mental illness. Over 1 in 5 youth ages 13 through 18, either currently or at some point during their life, have had a seriously debilitating mental illness. About 1 in 25 U.S. adults live with a serious mental illness such as schizophrenia, bipolar disorder, or major depression. What causes mental illness? There is no single cause for mental illness. Several factors can contribute to risk for mental illness. Adverse childhood experiences, such as trauma or a history of abuse, for example, child abuse, sexual assault, witnessing violence, and etc. Experiences related to other ongoing medical conditions, such as cancer or diabetes. Biological factors or chemicals imbalances in the brain. Use of alcohol and drugs, and having feelings of loneliness or isolation. And for me, whenever I went through my brain tumor surgery, I went through some very mental health issues with it. So I know that one from experiences with the experiences on the ongoing medical conditions. Why mental health should be taken more serious in the workplace and school. Positive mental health at work helps teams remain agile when changing roles and responsibilities. Not to mention, facing difficult challenges, it helps employees flourish in their roles, manage stress, and boost resilience. Ultimately, it allows everyone to reach their highest potential. Students' mental health is a crucial part of the education system. Ultimately, students with a positive mental health can build relationships more effectively, make decisions, and work together. These positive effects support the individual student and their larger community as they enter adulthood. The sources that I used to gather all this information was myclevelandclinic.org, mayoclinic.org, medlineplus.gov, medlineplus.gov again, cdc.gov, betterup.com, and k12.com. With mood disorders, anxiety disorders, personality disorders, psychotic disorders, what mental health is, why mental health is important for overall health, can mental health change over time, how common mental illnesses are, what causes mental illness, and why mental health should be taken more serious in the workplace and school can be so much information to take in. I want to encourage everyone to think about how serious mental health can be to you or someone you know. Whether it is in your household, work, or school, anyone can be dealing with these things, and no one knows how much a person is handling. With everything that was said, I know we should all push more towards the importance of mental health and bring more awareness to the situation. I want to thank everybody for listening to me, and if you have any questions, I'll be glad to answer them. Thank you.